Hello, this recording is to talk to you about how to do a health history. This particular document is the document that I want you to use when you're doing a health history. And as mentioned previously, I don't want you to put any personal information that is that can be traced. So I would like you to use our phony names and birth dates and that sort of thing. Under the source and reliability, I would like you to indicate whether the individual is reliable, meaning if they have dementia, you should indicate that there. The reason for seeking care in this situation, I would like you to just simply indicate that this is a student practice session. Present history or presenting illness, there will be none there. But so you're actually going to start by saying, in this case, the past history. So you're actually going to be taking the past history of a real individual. I would like you to have them describe their state of general health. So how do they feel? How do they consider their general health to be? Under childhood illnesses, have they had any chickenpox, mumps, measles, any particular illnesses? Have they had any injuries or accidents as a child? And at what age did they have them? Were there any serious illnesses, and at what age? Do you have any chronic illnesses? Were they ever hospitalized? And if so, for what reason? Did they have any operations, and at what age, and what procedure did they have? If they're female, did they have any children? At what age did they have them? Were they term? Were they premature? How many pregnancies? Were there any abortions? Were they incomplete? Did they have children, and are they living? Did they have any miscarriages? What was the course of their pregnancies? Were they normal pregnancies? What was their labor like? What was the baby's birth? What sex? Was it a vaginal delivery or cesarean? Were there any complications? What about their immunizations? Are they up to date? Did they have all of their immunizations? When was their last physical examination? Do they have any allergies? Was there any, and if they do, what are the reaction to their allergies? Now, under allergies, so remember that if there's allergies, it may be allergies to drugs, it could be allergies to the environment, or it could be allergies to things like latex. So remember to always ask about different kinds of allergies. And if they do have allergies, make sure you ask about reactions. What are the reactions to those allergies? Also, you need to ask about current medications. What medications are they on? And if they're on medications that are prescription versus over-the-counter medications. So a lot of people are taking vitamins and acetaminophen, aspirin, things like that. They also are taking things like birth control pills that they don't even consider to be medications. So make sure you do a good review of all the medications they take. Then you go into the family history. So you ask them, is there anybody in your family has had heart disease? Is there anybody in your family have allergies? Do they have high blood pressure, asthma? And if they do, write on here who it is that has the high blood pressure, if they have asthma, if they have stroke, if they've have obesity, if they have Alzheimer's. And the reason we're asking about this is these are hereditary diseases. So it's important that you indicate who it is, and if there's several people in the family that have it, write it down on this particular piece of paper. So diabetes, alcoholism, blood disorders, mental illness, ovarian or breast cancers, suicide, kidney disease, arthritis, tuberculosis, cancer, seizure disorders, and sickle cell anemia. On the next page, you would use the whole page to draw a genogram, and I'd like you to look in your textbook about how to draw a genogram. There's a specific order to do that, and so please use the appropriate schematics to do that. Then the next part of the history is the review of symptoms. Under the review of symptoms, I would like you to actually circle or to highlight anything that is relevant to your client. So first of all, you ask about their overall state of health. So what is their present weight? Have they had any gain or loss? And if so, over what period of time? And why did have they had a change in weight? Is it because they were dieting, or did it just suddenly happen? Have they had any fatigue, weakness, or malaise? Are they having chills or night sweats? What about their skin? Do they have any skin disorders? Do they have eczema, psoriasis, or hives? And if they do, make sure you highlight that particular item, and you then indicate whether they're being treated for it, when do they develop it, basically you always write about that particular item in the column here. So you actually, put information in the column about that particular information that they have, okay? If they have, then you ask about their hair. Have you had any hair loss? Is there any changes in texture? And if not, if there isn't any information about that, then you simply say not applicable. There any changes in their nails, any change in the color or brittleness. And then the other thing that you need to do after you've done that skin, hair, and nails is talk about health promotion. How much skin or sun exposure have they had? What do they do to help protect their skin and nails and hair? So in other words, do they use proper lotions on their skin? Do they protect themselves? How much exposure to the sun do they have? Then you talk about their head. Have they ever had a head injury? Do they have severe headaches? Do they suffer from dizziness? Do they ever had vertigo? And be careful about the words you use, because vertigo doesn't mean a lot to a lot of people. So have you ever felt that your world is spinning around you? Have you had dizziness, or have you ever passed out? So again, when you're looking at this particular document, it's meant for you as a health practitioner, but you don't always use the words that are here in front of you. You convert these words, like for example, the word under eyes, diplopia means double vision. Use the word double vision when you're talking to your client. Don't use diplopia, okay? So again, you literally ask the client every single thing on this page, but make sure that you're using the words that are right for the client. And again, now you're going to use health promotion about the eyes. Do you wear glasses and contacts? When was your last vision check? Are you tested for glaucoma? How do you deal with any vision loss? Now we ask about your ears. Do you have frequent ear infections? Do you ever have earaches? Do you have ringing in your ears? Not tinnitus. Do you have ringing in your ears? Do you have vertigo? And so as far as your ears are concerned, are you had any hearing loss? When have you had a hearing check? How do you clean your ears? Under your nose and sinuses, have you any discharge? Do you have problems with sinus pain, nasal obstruction, your mouth and throat? Do you have any mouth pain, soreness in your throat, gums bleeding, toothache? When is your last dental checkup? How often do you brush your teeth? Do you have prosthesis? And again, you ask about their neck, you ask about their breast. When do you do self-breast examinations? Then you go on to your respiratory system, ask all the questions about the history of lung disease. Do you have any problems with shortness of breath? Do you have any cough? Do you cough up any sputum? What is the color of it? How much? Are you exposed to any toxins? And again, health promotion. When was your last chest x-ray? Then you go on to the cardiovascular system. Ask the questions about cardiovascular. Make sure you know what these words are. Orthopnea, paroxysmal nocturnal dyspnea, nocturia. Again, I'm not going to tell you what those are. You need to look those up and ask the appropriate questions about them. When was your last x-ray? Have you ever been tested for heart disease? Do you know what the results are? Then ask about the peripheral vascular system and what are the health promotion questions about that. Then we're going to ask about gastrointestinal system, and then do you use antacids and laxatives? Then the urinary tract system, and what are their health promotion measures about that? Then the male genital system, only ask those of the men, and health promotion. The female genital system, you ask the questions for a woman, of course, and health promotion there. We ask everyone about sexual health. Are you presently in a relationship? Is it satisfactory? Is there any concern about having sexually transmitted diseases? Then you ask about the musculoskeletal system and health promotion that way as well. The neurological system, have you a history of strokes, fainting, blackouts. Then you ask about the hematological system, bleeding tendencies, endocrine system, history of diabetes, thyroid conditions, all of those things. And then we switch. Now we're going to talk about functional assessment, which are the activities of daily living. Tell me about your self-esteem, your self-concept. Tell me about your education. How far did you go in school? What about your financial status? These are open-ended questions. And do you have any concerns? What about your value and belief system? What is your religious practices? What about your self-care behaviors? Are you able to look after yourself? What about activity and exercises? What is your daily routines? Are you independent? Are you able to feed yourself, bathe yourself, toilet, get up, get up and down stairs? What are your leisure activities? Tell me about your exercise patterns. Do you actually, able to get out and exercise at all during the week? Are you interested in exercise? Do you have any other self-care behaviors? What about sleep and rest? How long do you sleep in a day? Do you nap during or in the evening, night? I mean, do you have any daytime naps? Do you need to take any sleeping aids? What about nutrition and elimination? Tell me about what you've eaten in the last 24 hours. This is also a good memory test. What is the normal menu you would have most days? Who buys the food? Who prepares the food? Do you have enough money to actually provide adequate food? Who's present during meal times? Are there any other things that you do that support good, healthy behavior? What about your interprofessional relationships? Describe what your role is in the family. How do you get along with your family, your friends, your co-workers? If you had a problem, who would you go to regarding that problem? How much time do you spend alone in a day? Is that pleasant, or do you find it isolating? How do you cope with stress? How do you describe the stresses in your life right now? Has there been any changes in the past year? What do you do to relieve stress? Are these methods helpful? What about personal habits? How much caffeine or coffee or tea or cola do you drink in a day? Do you smoke? If so, how much? How many years have you been smoking? When did you start? Have you ever tried to quit? How did it go? What about drinking alcohol? When was the last time you drank alcohol? How much alcohol did you have in that last time? Out of the last 30 days, how many times did you have alcohol? Have you ever had a problem drinking? Do you ever take street drugs? Have you used marijuana, cocaine? Have you used crack cocaine, amphetamines, barbiturates, LSD, heroin, any other drugs? Have you ever needed treatment for drugs or alcohol? What about your environment? Do you consider your home or the neighborhood a safe place? Do you live alone? Is it safe in the area you live in? Do you have adequate heat and utilities? Do you have access to transportation? Are you involved in any community services? Are there hazards in your workplace or at home? Do you use seatbelts? Do you travel to residence or to other countries? Are you in the military? Do you have you ever had an intimate partner violence? How are things at home? Do you feel safe? Have you ever been emotionally or physically abused by your partner or somebody important to you? Have you ever been hit or slapped, kicked, pushed, shoved, physically hurt by your partner? Has your partner ever forced you to have sex? Are you afraid of your partner? What about your occupation? How would you describe your job? Do you work in any health hazards? Is there any equipment at work that designed to reduce your exposure? Is there any work programs designed to monitor your exposure? Is there any health problems you think are related to your job? Do you dislike your job? What about your own health? How would you describe your health? How do you view your health right now? Do you have any concerns? What do you expect will happen to your health in the future? What are your health goals? What do you expect of nurses and physicians? If you were to develop a care plan, a plan to improve your health, what would it actually be? And then you're going to actually develop a plan with the client, and then based on that plan, I would like you to come up with some references that are actually appropriate to build a health care plan. So that is what your health history is all about, is taking a holistic head-to-toe assessment of all systems and then develop a healthcare plan of one need that is based on that history, that is based on what they think they need as well, and then using a valid resource and reference that will actually support that plan. So that's what you're intended to do, and it's to be completed and handed in for week 4. Okay, so we can discuss that further. Please send me emails for any questions on that.